Hey there, so my name is Odile, and I'm so glad you are joining me today as I am tracking my kind of wellness, my fitness, my wellness, my mobility and flexibility is really what I'm going to be focusing on in conjunction with, for me personally, training for the half marathon I'm going to be doing in 2 months. You may be training for something else. You may be just training for life, for just the rigors of life. This that I'm going to be doing is specifically for the things that I'm needing, but I do notice that these are stretches and exercises and movements that I give to my clients for all types of different activities, whether it's golf, whether it's running, whether it's swimming, skiing, because all of those sports, and any other sport as well, and weight training, walking, all those things involve the hips, the legs, the low back, the feet. So there'll be a lot of focus, not on sport specific necessarily, but body specific, right? And then how do we create strength and flexibility for the duration of whatever we're going to be doing. So that's really my focus. It's to keep me honest, to keep me in my practice, rather than forgetting to stretch and expecting my body to do amazing when I need it to perform. It really is a co-creation with my body. I need to show up for it, just like I am hoping it will show up for me. So we're going to start with feet. Feet, don't fail me now, I can hear one of my clients say. So first thing we're going to do is we're going to put the foot, I'm going to start with my left foot, which to you looks like my right foot, and I'm going to place the ball, I'm grabbing a little tennis ball kind of thing, and I'm going to place it not on my heel and not at my arch, but right at the heel arch pocket. So it's in front of the heel behind the arch, and I'm going to press on that about 3 times. So there is 3. Now I'm moving to the toe balls, right? So the toe balls are like the knuckles, not the fingers themselves. So not the toes, not the phalanges, but the toe balls. And I'm going to press on the first big toe ball. And I'm really noticing I could use a pedicure or to take off my chipped nail polish. Okay, 3 times on the first big toe ball. Then I'm going to move over to the second toe ball. And I'm pressing, and pressing, and pressing. And at first it might not feel like much. Third toe ball, press. But the more your body relaxes into it, the more it realizes there's actually a lot going on here. And press fourth toe ball, 4. Good, 3 times. And then fifth toe ball over to the pinky side. So I'm on the pinky down on the toe ball, which is a little lower than maybe where your second or third is, right? And you're gonna press, good, nice, 3 times. Okay, now we're gonna press onto the instep of the foot. So the instep is the inside arch. And you're gently, so this, especially for people who have plantar fasciitis, you want to really be careful. And I am, to be perfectly honest, experiencing a little bit of fascial tightness and some burning sometimes. So that's something I really need to be honest about and pay attention to. So I'm pressing on the instep of my foot 3 times. It should not hurt. In terms of negative pain, it may be just very sensitive, and use your sensitivity as a measure of how much to press. So it should not hurt, pinch, or burn, but a little bit of sensation, right? Maybe a little bit of discomfort is okay, but you need to decide for yourself if that is a positive moving towards release or something negative that is moving in a bad direction. And if it's moving in a bad direction, you do not want to keep pressing, okay? All right, so I am rolling my big toe now towards my heel. So if you look at me sideways, I'm rolling, 2 and 3. And we're gonna do each one, okay? Then you're gonna roll second toe ball. So at first this may seem really tedious, but it is incredibly therapeutic, feels so good. And third toe ball, 3 times. Each long strand, if you will, from your toe all the way to the heel, that line is called a ray. And you want to roll across each ray about 3 times. Fourth toe ball. I've been really lucky to work with some masters in my field who have really emphasized the importance of foot health and fifth toe ball. Good. And excellent. Okay, then we're going to come to the outside of the fifth toe ball. So you know how we were on the instep here? Now you're going to be essentially same line across, but on the pinky side, the outside, and you're going to press there. 5, 4, we're going to do it 5 times, I guess. 3, 2, we instructors kind of flip-flop our numbers sometimes. 1. All right, so there we did that part. Now we're going to keep the heel down, and we're going to, I call it windshield wipering the toes. So I'm taking my foot, spreading my toes as much as I can, and I'm turning my foot in and down and going out and in and out. And the benefit of this, gosh, so much. First of all, it stretches all those toe balls away from each other. So your toes are not all scrunched together. They like space. The body likes space. So try to remember that as often as possible. It's a good rule of thumb. And we're also supporting the arch of the foot by creating this twist and then stretching the arch. Couple more. Breathing. Okay, and then you're going to roll that out. So foot health, gosh, is so primal, especially for a sport like running, but really any sport, even if you're doing something like swimming, which we would think like, why would I need my feet for swimming? How is that really helpful? Well, if your feet are really tight, you can't move your ankle. If your ankle's really tight, it makes it really hard to lengthen through your leg. If that's really difficult, then it makes it difficult to have a good kick when you're running. When you're swimming, right? So there's never not a good opportunity to work on the feet. All right, so that's that. I just did my right side, yeah. Now we're going over to the other side, and just take a moment before we swap feet to kind of feel the difference between the right and left side. Okay, now you're going to roll, or pump I should say, in front of the heel behind the arch on the left foot. 1, 2, just 3 times, 3. Okay, now we're going to come to the big toe ball and press. 1, 2, 3. So I didn't run today, go second toe. Today is my day off. I ran yesterday. I ran almost 4 miles. And third toe ball. And I definitely feel it. I ran hills, so my hamstrings, the back of my thighs, are really, really tight. I have an old tear on my left side, which makes my left hamstring really tender. So I do not want to injure my hamstring in the process of this training. So I'm really, really doing everything I can to honor the old injury, strengthen my body, and pay attention when it tells me that it's enough, right? That I don't need to keep going. Okay, so now I'm going to roll from the big toe ball to the heel. Roll. And 2, and 3. Second toe ball. So I don't know if you can see, but I'm applying downward and forward pressure, going forward and going backwards. And third toe ball, press. 2, and 3. Fourth toe ball, press. 2, and 3, and fifth toe ball, press. 2, and 3. And again, you are applying enough pressure to feel like a massage, not so much pressure that it pinches or burns, right? We're not wanting to tear or rip or irritate the plantar fascia. That's the sole of the foot. You want to just stimulate it, get fluids going through the area, get some juice going through that area, fresh blood supply, which carry nutrients to the area. Okay, so here we are in the middle of the foot, right? And we're going to do some pumping in the instep middle of the foot. Pump, 2, 3, and then let's go across over to the pinky side because I forgot to do this part. 1, 2, 3. Okay, now we're doing our windshield wiper and toes down, turning in. So this routine that I'm doing today is one that I do regularly, not only on the days that I run, but actually on the off days, obviously, and even when I'm not running. I do this very regularly to create flexibility in my feet. Okay, all right, and then just kind of roll it out, smooth and easy. Okay, so we're gonna put the ball aside. Next thing you're going to do is grab your mat and lie back on your back on your mat. Okay. I notice my video looks like it's a little downhill, and obviously I'm not on a hill, although you may not know that. Okay, so I'm going to put my hands under my sacrum. I'm going to make the shape of a diamond, and I'm going to put my hands under my sacrum. My sacrum is the bone at the very bottom of my spine. It kind of looks like a spearhead, a triangle. So the wide part of the triangle is up on the top of the sacrum, meaning close to the low back, and the point is at the bottom. That's the coccyx. So what I want you to do is gently tip your pelvis backwards. It's called a posterior tilt. And as you're doing that, you're even pushing into your hands a little bit and creating a stretch of the low back and tipping your pelvis. And then you'll arch. And when you arch, you'll feel like your coccyx is going towards your index fingers, and you're arching the small of your back off of the mat, and then you're curling and trying to flatten the small of your back against the mat. So this is called a posterior tilt. And then going the opposite way is an anterior tilt. Keep going, couple more. When we're running, our back kind of, I know for me, it gets fixed in one position, and I don't notice that it's getting tighter and tighter and tighter until, gosh, somewhere, many miles into my run, and I just feel like my back gets so stiff. Sometimes I don't even notice it until the end of my run when I'm, let's say, taking a shower or making dinner or something like that. And then I'll notice, geez, it's so tight. So this refreshes, literally flushes the low back out of the old fluids and brings new fluids in. I know I'm repeating this. I'm arching and curling repetitively, but I say even 10 times. All right. Now you're going to tip side to side. So I am tipping my pelvis to the left and right. So the idea is I'm weight shifting over to the left butt cheek, not my knees doing the work, but I'm weight shifting, really using my abdomen, and then weight shifting to the right. I would say this is probably one of the most difficult movements for myself and my clients because it's very subtle, number one, and number two, this isolated rotation we don't do very often. And yet when we're running, this is part of our running gait. We don't recognize that it is, and if it isn't, we need to bring it in, this rotation. It's very small, but it's part of the movement. Okay. And I'll talk more about kind of running gait and gait mechanics and that in further videos, but I kind of just want to get going and do some stretches together. Okay, so now I'm going to reach my tail. So I'm picturing my coccyx, my tail, and I'm going to swoosh my tail over to my right. So that's lengthening my left side. So my whole left side body is getting long as my right side is getting short, and then I'm changing. And if you want, you take your hands out now, right? So wag your tail and wag your tail. Keep going side to side. And you might notice, Gosh, one side of my back is so much tighter than the other. That's totally normal. But let's see if we can't restore as much fresh fluids into both sides of our spine as we can, helping to ease the tension, which that then brings more space. Okay, one more each side. Excellent. So I don't know about you, but my hips get really tight for sure. So I'm going to interlace my fingers at the base of my skull, take myself into this figure 4. And then if you're up for it, depending on your spine's health and your shoulder health and your neck health, you're welcome to nod your head, curl up, and kind of bring yourself towards your leg and then lie back down. Inhale, exhale, curl. So this just stretches the whole fascial line. So fascia is everything from skin all the way to the soft tissue, to the connective tissue, and some people even say bone is fascia. It's just very dense fascia. And I believe them. One more, and curl. Everything is pliable to a certain degree, some things more than others. And lie back down. And change sides. So now I'm interlacing my hands behind my left thigh as I bring my right ankle across my left knee. Inhale and exhale, and I'm curling up here. And if you are not adding the curl, I'm 100% cool with that. Maybe you're not doing that because you really want to just emphasize the hip stretch. Great, do that. And 2 more, and I'm curling up. I haven't really talked about core yet right now because I'm really focusing right now more on kind of mobility of certain parts of my body, my joints, my feet, my pelvic mobility, right? And then that hip mobility that we just did. All right, so from here we're gonna hug the left knee into the chest, stretching through the right leg, and pull that knee in so that you feel even a little squeeze in your left kind of hip area. Make sure that it feels okay. And then inhale, exhale, nod your head and curl up. Really stretch that. And bring that down and change. Again, this is all the posterior line, the back tissue. Everything from skin all the way to the density of the bones is getting stretched here. And this is really, really good. Pull, curl, and lie back. And 2 more. I'll talk about core in the next video, but today, again, let's just kind of focus on the flexibility part. 1 more each side. And last time, last side. Okay, so from here, I want you to open your knees out, right? So my knees are kind of in this wide position here, and your arms are out, and then just sway your hips from side to side. So I could say sway your knees from side to side, but I want you to think more about coming from the center of your body, which would be your hips, and the center of your pelvis, rather than coming from your knees. Because when I'm running, as much as I can stay connected to my center, not just my feet, not just my legs, but my center, the better I run. So I'm already starting to create a mindset of kind of, you know, pelvic centered, hip centered, core centered, rather than leg centered. 1 more. Good. And last time, last side, over. Excellent. And then coming back. Okay, so we're going to come on up. So next for me is stretching into my hips in terms of the hip extension. So the hip extension is what opens up. Let's do this side first. I'm going to do my left leg forward, right leg back. So hip extension is this opening here, right? Extension means open, flexion means close. We'll say in this, overly simplifying, but it's good to think about it that way for the moment. So we're going to stretch forward, opening up through the right hip, pushing down into the left hip, and then sitting back and getting a little hamstring stretch on that left side. All right, and forward. Inhale. And notice as I'm coming forward, I'm opening my chest, my eyes are going forward, so I'm bringing my posture into it. I'm not just making it about my hips and legs. I'm bringing my whole spinal posture into it. So some folks may need yoga blocks underneath their fingertips or chairs, right? If you're really, really tight, and go back and forth. So that with your hands up on something higher, you probably could open your whole posture a little bit more, right? If your hips are really, really tight. 2 more like this. Forward, open, and back. Last one. Open and back. All right, other side. So now I'm taking my right foot forward, my left knee is back. I'm sending my pelvis forward. So the pelvis is made up of everything in the front, the pubic bone, the 2 hip bones, right? Then down to the tailbone, that's considered part of the pelvis, all the way to the back hip bones. That whole bowl is called the pelvic bowl. And back, stretching that right hamstring, and forward, and back. And because today is a non-running day, I'm not doing a lot of just static stretching. I'm doing more mobilization, so more mobility. Again, pumping fresh fluids into the area. You're going to hear me say that a lot. It's the fluids that replenish and restore. If we don't get a chance to move our body, the fluids don't move. And when the fluids don't move, it creates a sense of stickiness, inflexibility, and tightness. So here we're pumping fresh fluids in. This is where active stretching comes in really handy. Last one. Good. And bring that back. Perfect. Okay, so we're going to go into a hamstring stretch here. For your hamstring stretch, you could grab a stretch band, and I happen to have a stretchy stretch band. If you have a yoga strap, that's kind of just a solid strap, you can do that. And again, this is going to be a little more motion, less just static. So I'm straightening my left or my right leg. I'm going to start with my left leg up to the sky, and I'm going to bend my knee and push my leg. And when I push my leg, I want to engage from the hamstring. So find and feel that muscle, and then I bend and I'm stretching that muscle, and then I push and I stretch up. Inhale and I bend, opening up through the hamstring. Exhale, engaging the hamstring as I straighten the leg. Maybe your straight is not 100% straight. I'm okay with that. And reach up. One more. Inhale, bend. Exhale and press. Okay, we're going to hold here for 4 breaths. And as we're doing that, we're circling our ankles. So going back to that foot and ankle health as an integral part of your leg, hip, and low back health, and of course the rest of the body. And then let's circle the other way 4 times. 2, 3, 4. This feels really good. Okay, let's change legs. So now I'm putting my right foot in. Even if you don't have a stretchy strap and you have your yoga strap, you can do the same exact thing with that yoga strap. So here I go. I'm going to bend. Still kind of holding that resistance, but working the muscle in the back of my leg and thigh as I press to straight. Inhale, bend. Exhale, press. Inhale, bend. Exhale, press. 2 more. Last one. Good. And then hold that leg up there, circle 1, 2, 3, 4. And just keep coming back to your breath. Sometimes stretching can feel a little boring, or it can feel very relaxing. But when we connect into our breath and into our body and really feel what's happening, I find that it's not boring at all. It's actually super fascinating. Okay, we're going to bend and bring that in. Go back to your left leg. right leg down, and we're gonna go across the body. So now I'm taking my left leg across the body over to the right, and then I'm gonna open it out to the left. So I'm going across and across and across. I'm moving, not my foot per se. Yes, my leg is moving, but I'm thinking about the ball in the cup stretching. 2 more, across and across. Inhale, exhale. Remember, we're thinking about mobility and flexibility. This isn't exercise per se. It's not like we're burning a lot of calories. What we're doing is we're preparing our body for activities that do help us burn more calories. We need the mobility and the flexibility so that our body can function well when we're doing our activities. Good. Okay, we're going to come across, circle it down, out, around, and up. Pilates leg circles with the assistance of a strap. 2, and I want you to think about the ball, so you can close your eyes, your thigh ball rolling in the hip cup. This is where the core comes in handy because it helps to really keep that pelvis stable as you're circling the leg around. Let's go the other way. Open, across and up. 2, 3, I can really feel my hamstring on my left side. 4, as it kind of stretches over the thigh bone as that ball is rolling in the cup. 5, great. Okay, let's go on to the right side, leg up. And I'm going to go across my body. So left leg crosses the midline over to the left side. And then I'm opening my right leg out to the right, just enough to feel the ball kind of swinging like a pendulum in my cup. So it's pressing to the outside of the cup as I cross my leg across my body, and it's gently gliding into the inside of the cup as I open my leg out. Couple more. Keep your visualization strong and powerful and like a little movie screen in your mind of what's happening so you can see it. It's so much more effective when we can see it. Okay, so now we're going to go across, bring it down, circle around and up. And 2, just 5 like this. Can you keep your pelvis super stable? 3, 4, and if you can't achieve a fully straight leg, that is so okay. That is absolutely okay. And you can keep the knee bent. That's totally fine. Also, if you're feeling some popping and cracking of the hip, kind of the ball rolling around in the cup, unless there's pain, that's typically okay. You don't want to keep grinding away at it. So maybe make your circles smaller. And over time, you'll feel like, oh, there's a lot less popping and cracking because the joint has become more lubricated. Okay, perfect. And then you're going to let that go. Okay, we're going to stretch their calves now. So come on up. And I'm going to use my foam roller as something to stand and give me some balance. So I'm using my foam roller. I'm going to put my left foot forward, right leg back. Okay, so the first thing I'm going to start with is a straight right leg. Then I'm going to, actually I'm being a little too ambitious, then I'm going to bend my knee. Straighten the leg and bend the knee. You may not be able to bend your right knee very much if that right leg is back because the front of your shin is very tight, right? That's okay. That's okay. Just take it nice and slow. It's more about opening up the back of the Achilles, the back of the ankle. It's not about straining the front of the shin, and bend. Keep that heel bone though down. Last one. And bend. And hold here 3 breaths. 2 more breaths. Last big breath. See if you can relax that front of the ankle. Good. And then straighten the leg and breathe. And if you're not feeling much of a stretch, definitely come to a wall, find a way to feel that stretch, not only through the front of the hip, but the back of the calf muscle, right? Good. Okay, and then we're going to change legs. So now we're going to put the stretch band. We're going to put the leg behind. Okay, so now I've got my left leg behind. Oh yeah, definitely tighter on this side. So I'm going to bend my knee. Soft, soft, soft ankle in the front on that left side, and then straighten my knee. Inhale, bend. Exhale, straighten. Inhale, bend. Exhale, straighten. 2 more. Inhale, bend. Exhale, straighten. Last one. Inhale, bend. And exhale, straighten. And stay here. Straight leg. Shoulders are soft, right? Checking your posture so you're not looking down at your feet. You're not overarching your back. You're feeling your pelvis or your tailbone kind of angled towards the floor rather than pointed behind you. Engaging in your abdominals again. Next video, I'm going to add a lot more core so we can talk more specifically about that. And then now just bend your back knee ever so slightly, keeping the heel down. And this is the Achilles, right? The other one was calf muscle, the gastrocs. But here we are stretching the Achilles, which is a tendon. One more breath. Good. Okay. So very last thing, if you happen to have a foam roller, I'm going to have you lay on it. My foam roller has kind of a preference as to where it likes to be. If you don't have a foam roller, that's okay. You could grab a huge beach towel or blanket and roll it up. Okay, so you're gonna roll it up so it's like a long tube. You can also roll up a couple of towels, right? And use them to you just wanna give your spine a tactile difference. So you want your spine to feel that it is supported right along the bones so that all the muscles that are on either side of the spine can start to relax and melt around whatever it is that you have. Some folks I know are so tight just in the front of their body that even just lying flat on the floor is an incredible stretch. So if that's you, that's fantastic. Just lying on the floor, opening your arms to the shape of a letter T, or if you're up for it, you're going to take your arms into like goalpost or cactus arms and just breathe here. So in running, the pec muscles voluntarily and involuntarily become active as we're swinging our arms. And so we want to stretch the pecs. And underneath the pecs are the intercostals. The intercostals are the muscles that weave through the ribs, and those can become tight when we're doing all that deep breathing, especially hill running or sprints. So you want to open up those intercostals. As the intercostals release, it gives more room for your lungs to take in and breathe out air. A couple more breaths here. And notice if one side is tighter than the other. Last one, inhale. And exhale. Great. Okay, when you're done, I like to just kind of plop off carefully and lie on my back. Breathe into where the foam roller or the towel was or the blanket. It's almost like this trough. And suddenly I feel all this new space in my spine. One more breath. Okay. So I hope you found this really helpful, and give it a go. See how it feels and how it supports you through your kind of off physical day. And again, this is not only for running, this is for everything, and send me a message. If you like this video, this is the part that I'm not very good at. If you like this video, hit subscribe. I will be posting videos, so you'll get a little alert every time I post something. And leave me a message and let me know what you think, what you found helpful, and what you would like to see more of. So have a wonderful day, and I look forward to seeing you next time. Bye.